Hello and welcome to our Thursday educational webinar on the basics of Medicare in detail. Everything you need to know explained in the simplest terms possible. So let's go ahead and get started. My name is John. I'm president of Riley and Associates. We specialize exclusively in Medicare. We are a local independent insurance agency with over 2 decades of health insurance experience. Today, we're going to go ahead and cover the basics of Medicare, your two options, and then our services. So our goal is to keep things real simple, but with Medicare, and that's probably why you're on this call, is that there's a lot of details, rules, and deadlines. So we'll be covering quite a bit, but hopefully we'll get all your questions answered. Okay. All right, so let's go over the basics. So what is Medicare? Medicare is health insurance provided by the federal government for those age 65 and older, and those under 65 with certain disabilities. Part A and Part B are known as original Medicare. Most people qualify for original Medicare as long as they're 65 and either they or a spouse is paid into the program for 10 years or 40 quarters. And Medicare has four parts. We're just going to start with Part A and Part B. Like I said, that's known as original Medicare. Everyone needs to sign up for original Medicare, and you should sign up 2 to 3 months prior to your 65th birthday or when you plan to retire and come off your large group plan. So Part A here, that is your hospital insurance. It covers inpatient stays and skilled nursing. Part B is most everything else. That's your doctor visits, labs, x-rays, diagnostics, and even outpatient surgery. So Medicare Part A and Part B, that's known as original Medicare, and there is generally no cost for most people for Part A. For Part B, however, there is a premium. It starts off at $202.90 in 2026. And then if you're a higher income earner, they adjust that up. And it's called IRMA. It's called Income Related Monthly Adjustment Amount. There's a chart. We'll look at the IRMA chart here in just a few slides. Okay, all right. So now that you know about original Medicare Part A and Part B, let's put this all together. So Medicare here has four parts. Part A is your hospital insurance, and Part B is your medical insurance. Those two combined make your core health insurance. If you're going to stay with original Medicare, and people that are typically on a PPO that want more freedom will stay on original Medicare, you're going to actually add a supplemental that's going to pay for the out-of-pocket costs like the deductibles and co-insurance. And then you're going to add a Part D drug plan, which we'll look at all of these here shortly. But your Part D Medicare, original Medicare does not come with prescription drugs, and you have to have that once you sign up for Medicare. It's required, even if you don't take medication. So if you're going to stay with original Medicare, you're going to generally add a supplement and a Part D. And then your other option is called the Advantage, or like it operates like an HMO. It's an alternative way to receive Part A, Part B, and Part D of health insurance of Medicare. So you really just have those two options. Either you're going to go with original Medicare, add a supplemental in Part D, or you're going to go with option number 2, which is going to be an Advantage plan that operates just like an HMO and covers both A, B, and D of Medicare. Okay, so those are your two options. Let's go ahead and let's take a look at our next slide here. I put this up here just because I strongly suggest for anyone before you turn 65, or if you're going to be coming off a large group plan, 3 months prior to that, you want to set up what's called a discovery call. And why is that important? You just don't want to miss a step or a deadline. We do see it where people miss their enrollment period, and it's going to cause out-of-pocket extra penalty and out-of-pocket costs, and lapse in coverage. So there's just a lot of rules. You don't want to do that. So during a discovery call, what we do is we determine kind of your timelines. We compare your coverage. We create a schedule for you based on your needs, your timelines, and then in the meantime, we begin preparing a presentation and options for you, similar to what we're looking at here today. So basically, we set your path, we guide you through the process, and then we get you enrolled on time in a plan that's right for you. And there's no cost for our services. We're a broker, and so it definitely benefits you to work with us. We cover most of your plans and carriers. Also, for employers and partners watching today, we suggest a planning meeting at age 62 for your employees or clients, just because Part B is based on your annual income. And so you don't want to get to retirement and then realize you have a huge Part B premium. So we do have like a video and checklist. You can fill out a form and we'll send that over to you. And it is really helpful to have that planning meeting. So now let's go ahead and we'll move on to the initial enrollment period for people turning 65 and then other election windows. Okay, this stuff is really important. This is where most people trip if they do. There's 3 main enrollment periods. Let me turn on my little thing there. Okay, great. So there's 3 main enrollment periods that you need to understand at this point. And then there's a couple I'll cover with you, which are just good to know about. So your initial enrollment period here, that's for when you first turn 65, everyone has to sign up for original Medicare Part A and Part B during this initial enrollment period, unless you're with a large group employer and you're going to delay Part B. But during your initial enrollment period, you've got a 7-month window to enroll. I don't recommend you wait. Typically, like I said, ideally you want to set up a discovery call 3 months before, excuse me, 3 months before, and then get enrolled into original Medicare if you're not delaying Part B. And you can still get Part A at that point, but we can talk to you about that. But if you're signing up during the initial enrollment period, you're turning 65 and you don't have large group employer coverage, then you've got the 3 months prior to your birthday, the month of your birthday, and 3 months after your birthday to sign up. Okay, so the other thing to know is that when you do first sign up, it's going to start the effective date for your Part B and Part A when first signing up is generally going to be the first day of your birthday month. However, if your birthday does fall on the first of the month, then it's actually going to start 1 month prior. So when you set up a discovery call with us, we go over that, and so there's no surprises there. Okay, so additionally, too, if you're receiving Social Security retirement income, Medicare is typically going to enroll you automatically 3 months prior to turning 65 if you're already receiving Social Security income benefits. And then you'll get your card a few weeks before the effective date of your birthday, the month of your birthday. But for everyone else, you need to sign up online, and so you definitely want to get that done and do that during the right time window. So the next enrollment period we'll look at here is your supplemental, also known as Medigap. Okay, so your initial enrollment period to be aware of for Medigap is called the open enrollment period, and that's when your Part B first goes effective. So if you've delayed Medicare, and you're now signing up for Part B, that's when this enrollment period will begin, and it's effective for 6 months. So you have a 6-month window to sign up for a supplemental where they cannot deny you or increase your rates due to health issues. So that's an important thing to know. So if you are going to go the supplemental route, you definitely want to plan ahead, make sure you get enrolled on time. The next enrollment period that we want to take a look at is called your annual enrollment period. And this is for everybody. It runs October 15th through December 7th of every year. And this is a time where you'll review your plan, make sure that your medications and doctors are still covered and the benefits are what you want. We have a process for this, so we send you out kind of a campaign. We start in August, letting you know this is coming up with a secure link. That way you can securely just update your medications, doctors, any changes there. It goes directly into our system securely, and we're able to there run a quote for you and make sure that your doctors and your medications are covered come January. Because if you need to make a change, we want to do that with no surprises, right? So that's what we do during that period is we review everything. So when you get to January, you're in real good shape. All your doctors are covered and your medications are covered, because these plans, things can change every year, and they do. Okay. Now, your last enrollment period is a place where you don't want to be. It's called the general enrollment period. Whoops, sorry, I skipped one. Your open enrollment period. Sorry, that's your for Advantage plan. So these are the two that you really don't need to know about when first signing up. But if you're on an Advantage plan, that's the alternative way to receive your benefits. That's the HMO option. Say, for example, you missed the annual enrollment period and you come to January and you realize, oh, a doctor's not covered or big medication is not covered. You have the 3 months called the open enrollment period for people on Advantage plans, and we can shop it for you and put you into a plan that is more appropriate, that covers everything that you need covered, and you can make that change in the first 3 months of the year. So if you miss that annual enrollment period, you can make that change in the first 3 months of the year, which is good. And then you can also disenroll and go back to original Medicare and Part D. So that's something to know as well. And then the last one that I skipped to was the general enrollment period. And the general enrollment period means you missed your initial enrollment period. Not a good place to be, right? You're going to pay generally a lifetime late enrollment penalty, excuse me, and you usually have a gap in coverage, so you're going to have out-of-pocket costs if you had to go to the doctor or hospital. So you definitely don't want to land up in the general enrollment period. Anyway, I hope that's clear. If not, give us a call. I'm happy to explain it to you. But when we're live, all over the place, right? Okay, so let's take a look. Now we're going to take a look at the costs. We've already covered now basically, Part A and Part B, and now we want to take a look at what are your out-of-pocket costs more specifically. What are those deductibles and co-insurance and that sort of thing. So when you get original Medicare, it's not complete. It doesn't cover everything, right? So Part A and Part B, again, this is your core insurance. This is your hospital. This is your medical, everything else. And with original Medicare, you've got some out-of-pocket costs. You have a deductible for hospitalization of $1,736. And that's not annual, meaning if you have an event, you go to the hospital, you're out for more than 60 days and you have to go back into the hospital in the same year, they can charge you that deductible again, and they will. Okay, so just to know on that. And then the 434, that's if you're in skilled nursing for quite some time, you're going to have that copay. You also have 20% coinsurance as you use your original Medicare for seeing doctors, labs, x-rays. And then you have a Part B annual deductible. This is annual, so it's a one-time deductible of $283. So on the two options that we're going to take a look at, option one, which is you stay with original Medicare, you add a supplemental and prescription drug plan. The original Medicare going with the supplemental are going to cover all these costs except $283. So if you go with option one, which we'll cover here shortly, you're going to have a $283 deductible that you're going to pay at the beginning of the year when you start using your Part B services like lab x-rays. But once you pay through that, you're done. Everything else is covered by your supplemental. And then if you go with an Advantage, which is your option two, all of these items here are going to be covered, your out-of-pocket costs. Okay. So when we first got started here, I just mentioned that for most people, your Part B premium is going to be $202.90. Again, your Part A is free for most people. There's no premium for Part A. For Part B, there is. It starts off at $202.90. And if you're a higher income earner, you can see here on the chart, you're going to end up paying more. Okay, so what's going to happen when you first sign up for Original Medicare, you're going to get a quarterly bill. So the first thing they do is they bill you quarterly, unless you're already receiving your Social Security income benefits, then they just deduct it from your bill, from your benefits monthly. But for the rest of us, when we first sign up, you're going to get a quarterly bill, and it's going to be for the first 3 months. So they're going to charge you the $609, $611, something like that, for your first month's first quarter premium. And then they're also going to you're going to get a second bill. So kind of wait for it, right? You get a second bill for the IRMA if you're a higher income earner, and then they're going to give you an adjusted amount as well. Okay, so that's just something to know, that your first bill is going to be quarterly. And if you're a higher income earner, you're going to get an adjusted bill as well. And if your income, they determine your Part B premium by your tax return from 2 years prior. So if your most recent return drops you in a lower bracket, there is, a form you can fill out, and you can, submit an appeal. We can help you with that. We have an email and the template and all that stuff for it. But you can submit that, and usually they'll review that and adjust that down. But this is going to be based on your income, so it can move each year. But generally, once you're retired, your income's going to go down and stay down. You'll generally stay in one of these brackets here. Okay. And then the other thing to know is that if you do trigger here a Part B premium, you're going to trigger a Part D additional premium that you're going to pay to Social Security as well. So this is paid to Social Security, your Part B premium. And then if you trigger here, you're going to have a small Part D premium. It's based on the same chart called the IRMA chart, Income Related Monthly Adjustment Amount chart. And we'll take a look at that here in a few screens. Okay. All right. So now let's go ahead, now that we've covered, Original Medicare, your timelines and costs, let's go ahead and take a look at your options. What I like to do is just kind of show you where you're at now before you go to Medicare. So whether you're with an employer plan or you have an individual family plan, something like that, you're on one of two types of plans. Either you're on a PPO plan or you're on an HMO. So the PPO generally gives you a lot more freedom. You can go to a larger network of doctors and hospitals, usually out of state, for employer plans, and you have to stay within their carrier network, but you've got a lot more freedom there. But you also have more generally higher out-of-pocket costs when you're comparing like to an HMO. But you're going to have a little higher premium and out-of-pocket cost, but you're paying for that freedom to be able to kind of do what you want. Excuse me. With an HMO, if you're on an HMO now with your employer individual, you're going to have a primary care physician who's going to direct your care. They're going to be part of a medical group, which is associated with a community hospital. So here, you're generally going to have lower premium and out-of-pocket costs, but you've got more rules. Generally, you have to get, a referral from a primary care on some plans to get to a specialist. Sometimes you have prior authorizations you need to get, but that's how that works. And I will say here in Southern California, We handle other states as well, but here in Southern California, we have one of the best HMO networks in the country. I mean, you've got Cedars and UCLA and Torrance Memorial and Providence and PIH, and the list goes on. So we're really, you're not doing bad either way. Whether you're on a PPO now or you are on an HMO, by going to Medicare, you're going to improve your benefits substantially. It works out really well. So let's go ahead now and take a look at your options when you go to Medicare. So if you're on a PPO, it's going to look more like option one. So for most people, if they're on a PPO, they want to keep that freedom. You're going to stay with option one, which means you're going to keep original Medicare Part A and Part B. You're going to add a supplemental plan that's going to pay for these for the deductible and out-of-pocket costs, and then you're going to add a Part D prescription drug plan. Okay, so that gives you a full comprehensive plan. And the nice thing is here is that you can go to any doctor, any hospital throughout the nation that takes Medicare. So you had freedom on your PPO, you've got maximum freedom here. And the insurance company doesn't have any say in your treatment of care, meaning if Medicare covers, your supplemental plan will cover it. So they're not involved in it anymore. And the only thing you would pay here on your health side is your Part B deductible, and then everything else is covered. And then you're going to have a separate Part D drug plan, which works really similar to what you have now. Okay. Your other option here is option two, which is basically you're going with the HMO model, which is called an Advantage plan under Part C, and they cover Part A and Part B of Medicare, and they include a prescription drug plan and other benefits. And we'll take a look at that here in a few slides. Okay. But for now, let's go ahead and take a look at option one, original Medicare with a supplemental, and Part D. Okay, if you go with that option, the way it works is that when you go see a provider and you've got original Medicare plus a supplemental, you're going to give them both cards. You're going to give them your original Medicare card plus a supplemental card. And then your providers aren't going to charge you anything, whether it's a doctor or a hospital. They're going to go ahead and bill Medicare. Medicare is going to go ahead and determine what their share is. They're going to go ahead and pay the provider, and then they're going to bill the supplemental plan or the Medigap plan, same thing, for that balance. And so, like I said, if this is the way you go, you're going to pay that first $283 when you first use the plan at the beginning of the year. But after that, the supplemental will pick up everything. So as long as Medicare covers, your supplemental plan is going to cover. Okay, so that's all great news, right? All right. And then here are the out-of-pocket costs or out-of-pocket categories that supplemental does not pay for, that original Medicare does not pay for, that your supplemental does. Okay, so it's going to pick up your deductible, except for Part B. It's going to pick up your major deductible, your co-insurance, your first 3 pints of blood. It's going to cover out-of-pocket maximum. It's even going to give you some foreign travel benefit as well. So those are the categories there. Okay, so let's take a look at option two. Option two is you're going to trade in basically original Medicare Part A and Part B, and you're going to go with an Advantage plan or Part C. And your Advantage plan or Part C covers Part A of Medicare, Part B of Medicare. It covers your deductibles and co-insurance, covers all your out-of-pocket costs, and includes a prescription drug plan, which works like a drug plan that you have now. And then you get extra benefits as well. This is a really good option if you're on an HMO now and you like your doctors and networks, you want to stay that route. This is a really good option. There's generally no premium here for most plans in California. With original Medicare, you're going to have a supplemental premium, and you might have a Part D premium depending on your medications. But if with an Advantage plan or an HMO model here under Part C, you're not going to have a premium with most plans. So you're only going to be paying your Part B premium. And either two options, you're always going to pay your Part B premium, but this one doesn't have any additional costs. So that's a really good option for a lot of people. And like I said, it covers a lot of extra benefits as well. It covers, your Part A, Part B, but it gives you your prescription drug plan included, and it covers things like gym, dental, vision, things like that. So you don't have to pick up those separately. They're included. Okay, so those are your two options. So I hope that makes it simple. You only have two options, just like on the plan now. You either have with your employer or family plan, you either have a PPO or an HMO, same two options. With Medicare, they're just called something different and your benefits get better. So it's really a good deal. So option one is original Medicare. You add a supplemental plus Part D. You're going to have a premium here for supplemental and maybe for Part D. And then here on the Advantage plan, you're not going to have a premium for most plans in California. And it's going to include Part D plus some extra benefits. So really, both are excellent options. It just really depends on your preference, your lifestyle, and your budget. Okay, I hope that's helpful. So let's take a look, just moving on, Part D, your prescription drug plan. So whether it's included in your Advantage plan or you purchase it separate with your option one with original Medicare and a supplement, it's going to work similar to what you've experienced through the plan that you have now. Okay, meaning that for generics, preferred generics means that it's on their preferred list. It's a pharmacy that is in their network. And so you're generally going to pay $0 to a few dollars for a preferred generic or standard generic. You might be a few dollars more, up to $10 or something like that. And then tier 3 is usually brand, their formulary brand. And then tier 4 is usually non-formulary brand. So other brands that are not on their nice list, right? On their formulary list. And then you've got specialty as well. And then tier 6 are specialty drugs that they give you at a low cost, like a generic. Okay, so that's how that works. Generally, most plans under Part D, they do have a deductible. Some of the Advantage plans do not, but the deductible comes into play most of the time for tier 3, tier 4, and tier 5. And you would pay through that, then you would go to the copay or co-insurance. So I hope that's helpful. One of the things that's nice too is they added here recently, which is the an out-of-pocket maximum. They reduced it down to $2,100, meaning that whether you have a separate Part D or whether it's included in your Advantage HMO plan, there is a separate out-of-pocket that for the drug plan, and it's $2,100. That means for drugs that are covered under the plan, your worst case scenario from January through December is $2,100. So whether that's on a separate Part D or it's included in your Advantage plan, that would be your worst case scenario. Now, you could be in the middle of the year and all of a sudden get a new medication that's not covered under your plan. So in cases like that, then we help you to find a coupon or find it through a specialty pharmacy where you can reduce your costs. Okay. And then during the annual enrollment period, we'll reshop it and get you on a plan that does cover your medications and everything. Okay, so I hope that's clear. This is just a different way to look at that, but it's just, again, here's your maximum out of pocket of $2,100. And then here you would pay through this deductible portion for tiers 3, 4, and 5. Like I said, if it's a generic, you're not paying through whatever the deductible is, up to $615 in 2026. But you wouldn't be paying through that if you had a generic for most plans. Preferred generic. And if you don't take medications, you're not going to have any copay costs or any costs here, but you still need to have a plan. It's required by Medicare that you have a prescription drug plan. So even if you don't take medications and you're in great shape and that sort of thing, you still need to get a Part D plan. So whether it's included in the Advantage plan, that's fine. Or if you go with original Medicare, you still need to add a prescription drug plan. But we do have plans that are $0 premium. So if you're not taking medications or just generics, that might be the way you want to go. Okay. All right. And then here is the Part D IRMA chart. So like I said, if you triggered your Part B premium and you're paying a higher premium to Social Security for because you're a higher income earner, you're going to trigger here as well. And so they're going to add additional, instead of say it's $400 you're paying to Social Security, you're going to add additional $37.50 in that category. And that's what they're going to do. That's what you're going to pay them, or they're going to deduct from your Social Security income. Okay. So I hope that's clear. If not, give us a call. All right. So let's go ahead and take a look at our services. Why do you need an insurance agent that specializes in Medicare? Well, there's a lot of reasons. One, it's complicated and confusing. It can be overwhelming. You'll get inundated with materials and it can get very confusing. But also there's just a lot of deadlines and rules. And so you want somebody on your side that can guide you through the process. There's no charge for our services. And so we help to educate you, inform you. We do the discovery call. We determine, we run the quotes for you to determine what's going to be the right plans and benefits for you. And then ultimately you're going to make that choice and enroll. But we help you with that whole process, the enrollment process. It's kind of like having a financial advisor or a CPA. We're with you, for life, hopefully, and we'll review these things for you every year. We send you a secure link so that we can get, changes in medications or doctors updated and run you quotes and compare the plans and do all that stuff for you. And then, areas that you might need help, like in dental and vision, we can help you with the networks there and get you into a plan and, assist you throughout the year. And if you do get a medication that's really expensive, we can help you in that area if it's something your plan doesn't cover. Okay, so I hope that's clear. Just in getting started, getting started with us, what does that look like? Well, we have a simple 3-step process. The first step is set up a discovery call. Like I said, you want to do that 3 months before you turn 65 or before you plan to retire or come off your large group plan. Set up a discovery call. And this is just a time where usually 15, 20 minutes, but we get to know you better. We understand kind of what plan you're on now. We can compare benefits with you, but we'll get you all set up, and then we'll get you, a couple emails after that to educate you or answer questions that you might have. And then in the meantime, what we do is we put together a presentation for you, similar to what you're seeing today. It's like a 30-minute online presentation, and we take you through the basics of Medicare. So it's a personalized plan review. We take you through the basics of Medicare like we're doing today, and then we go through your options. Options are specific to you, to your medications, to your needs, to your lifestyle. And then if you're ready, we get you enrolled. You choose the plan that you want to go with. We enroll you based on the options there. And then usually a few weeks later, after you enroll, we do what's called an orientation meeting. And during this meeting, it's similar to this again, to usually a 30-minute, online meeting, but we take you through your plan now, and we just answer all your questions, make sure you know how to access benefits, and we just make sure you're all settled. We also go over things that Medicare is not covered, so you don't have any surprises there. And that's our process. So it's a 3-step process. We follow it every single time, and it works out really well for us and our clients. And so our personal presentation, we go through the specific numbers and plan options based on your needs. But for today, this is just kind of a general idea of what your cost might be with option 1 or option 2. Okay. So if you go with option 1, you stay with original Medicare because you want the freedom to go to any doctor, any hospital throughout the nation that takes Medicare. You don't want anybody calling your shots. You want to do your own thing. This is the way you would go. You would pay your Part B premium. If you're not paying an increase through IRMA, it's $202.90. And then you're going to pay a a supplemental premium that can run anywhere from $150, $250 or more, depending on the age when you come in. So you're going to have that cost. And then a Part D, if you're not taking any medications or they're all generics, you might be a zero premium. If you're taking some really expensive medication, brand name, you're going to be paying, a premium for that type of plan that covers those things. So it could be on up to $200 now if they're really expensive meds. But generally, most people are, in around $0 to $5, $6 for their Part D. That's what we find for most of our clients, especially those just coming out of work or turning 65. Okay. So anyway, your total cost, and not including your out-of-pocket costs, which you would have for Part B premium, you'd have an extra like 283, and you'd have your co-pays for medications. But other than that, your fixed cost would be anywhere between $350, $450 a month, and that gives you total freedom, excellent benefits, and you do your own thing. If you go with option 2, that's the Advantage plan. It works just like an HMO. Again, you're going to pay your premium to Part B of $202.90. If you're getting hit with IRMA, it's going to be a little bit more than that. But for most plans here in California, you have a zero premium for your Medicare Advantage plan, and your drug plan is included. It usually covers any kind of deductibles as well. So usually you have very little in the way of out-of-pocket costs, maybe co-pays for some medications, things like that. But generally, you're going to be at about $202.90 your Part B premium. So whatever that is. Okay, so it's about half. So two really excellent options, and that's it. So I hope this has been helpful. Hopefully I'm getting better at this, and you're enjoying the process a little bit more. But we would love to help you. There's no cost for our services. We are a broker. We specialize exclusively in Medicare, and we do everything pretty high tech. We follow processes to make sure that you get enrolled on time in the right plan. And so if you're interested and you'd like to set up a discovery call, you can email me at john@riley.ebi.com. You can call me. You can go to our website. Our consumer website is medicaresouthbay.com. It's just a very simple site, and that way you can schedule a call. You can look at some videos, materials, things like that. But there's no cost for our services, and we handle most of your carriers and plans here in Southern California. So we can help you in all those areas. And then if you're an employer or agent or CPA and you don't handle Medicare and you'd like our help, we love educating and helping individuals. So you can go to our website at riley.ebi.com. Okay, so anyway, thanks for joining me today. I hope this was helpful. Have a great weekend and 4th of July celebration and 250 years, yay, right? So thank God we're in this country. And anyway, have a great weekend, and we'll talk to you soon. All right, thanks.